We moved here 10 years ago, me and my wife Alejandra, and we had this vision about health being a part of the environment that we live in, and we cannot be healthy, we live in an unhealthy environment. That's why we founded Sanar, which is called Salud y Naturaleza de la Riviera Maya, Health and Nature of the Mayan Riviera, with this vision of providing services of complementary medicine or integrative medicine, and also services of environmental stuff or environmental health, because those were our two concerns when we founded Sanar. Well, first time I studied MD as a medical doctor in UNAM. I graduated there, and then I studied 2 years of anesthesia residence. I did 2 years of anesthesia residence, and then I did a specialty in medical acupuncture. The training in anesthesia allows me to treat a lot of different pain procedures and pain things. A lot of our practice is focused upon pain and pain management, but also the specialty in medical acupuncture allows me to use acupuncture as and incorporate it in a general medical practice. So there's almost no ailment that won't respond to acupuncture, at least to a certain point. So we can incorporate this technique to a bunch of other things. And that's the thing with integrative medicine. We don't stop being medical doctors, but we also integrate complementary therapies that can bring more quality of life or a better result for the patient. We were the first also to bring ozone therapy as a therapy here available. And I practiced it 2 years before in Mexico City as an acupuncturist, but not with all the integrative therapies that we have down here. We have this vision that for diagnosis and for analyzing the case, the scientific approach, the Western medical approach is the best, because we can know, or we know everything about the moleculars, whatever's of the disease. But when we are doing therapy, we lack things. We are not just something to pop a pill on or something to take a remedy. Our body is a lot more complex than that, and it requires more complex interventions to heal. It's not just give you something from the outside. Most of the time we need to clean the inside so it can work. So with this vision in mind, we wanted to provide a clinic that have this integrated services where you can come in, whether you have a flu or some bug and need an antibiotic, but if you could also come if you were dealing with stress and you want to treat anxiety in a different way. So we founded the clinic with that spirit in mind, to be able to provide integrated medicine and bring the treatments that we have to more people. Well, the diagnostic scanner is a tool that provides us information about the physico-electrical state of the human body. It is different from lab work, because lab work probably is reading more chemical or biochemical presence of a substance in whatever fluid we're measuring, whatever tissue we're measuring. And this, we're sending electricity from one end to the other end. We're measuring what's happening with that electricity. Is that electricity conducted? Is it dispersed? Is it getting where it needs to be? And through that, we can know about the composition of our bodily fluids and tissues. So the diagnostic scanner brings us another tool to add up for diagnosis. Particularly, we can diagnose how's the oxidative status of the patient, which is really important before getting ozone therapy, to know the oxidative state. Otherwise, we can overburden the antioxidant system, and it's not nice when that happens. You get in a lot of trouble. So that's why we need to know, and we do this. But we also know, for example, with the scanner, whether a person has leaky gut and sensitivity towards gluten or casein, the protein in dairy, in cow's dairy. And why we can know that? Because the protein, it's also gonna conduct the electricity in a certain way, and if it's gluten, it conducts it in a certain way, if it's casein, in another way, and that's how we know if you have that. So the diagnostic scanner is a tool to help us broaden the information that we have from the patient to the physical, electrical part of this picture. Yes, I do. Chronic fatigue syndrome, it's a complex diagnosis, a complex entity. We have to look at your hormones, but one important part and one important aspect that sometimes gets overlooked is the oxygen metabolism. How is our body reacting to oxygen metabolism? It's the Krebs cycle, which uses oxygen to produce cellular energy working completely, or there's an impairment there, and maybe that's why we get chronic fatigue. That's one of the parts that we can get, or one of the pieces of information we can get from the scanner, how's oxygen metabolism and the way to fix it. One other reason to have chronic fatigue is not to have excess, the amount of nutrients, particularly trace elements and vitamins, that are cofactors in many enzymatic reactions, and that could also bring us to a state of tiredness. That also we can know through the scanner. Yes, there's this one particular patient from the UK. She's a young woman, 30-something, mother of 3, and she was diagnosed with MS, multiple sclerosis in the UK. They took an MRI. She had neurologic symptoms and pains, and they took an MRI. They found an image that they didn't like. They said they labeled her as she had MS, and she came here. We did a scanner and we found out she had gluten sensitivity. So after 2 years in a program with no gluten, a detoxification program with the ionic detox, with homeopathics, ozone therapy, etc., acupuncture, 2 years later, she's completely healthy. She just took a new MRI a few months ago, and the MRI came out clean. So the doctors in the UK don't know what to do with her, because you're not supposed to get better from MS. But anyways, we know that she didn't have MS. She had gluten sensitivity in the brain, because the brain, that's one of the things with leaky gut. Those proteins breach the the blood-brain barrier, and they accumulate also in your brain. Well, I would like to say I would see them incorporated into conventional medicine, but unfortunately we're in the middle of a war. All the countries, but even now in Mexico, we have been harassed, and the health authorities and the big pharma people don't like the ways that we do medicine. For example, take ozone. Ozone, if we can treat pain, infection, modulate the immune system, we're taking out a lot of drugs from the shelves, and that big pharma doesn't like it, and the government doesn't like that, because it's funded by big pharma in much instances. So I see that slowly some of them are still going to be incorporated into mainstream medicine, but also some of others, like ozone, like maybe stem cells, platelet-rich plasma, are having a hard time to get incorporated because of the economic interest that they hurt. There's taking out of the business so many other things that the people in these therapies are not interested of these other therapies come out to light. So I see we're still going to be struggling for a little while, at least, I don't know, 5-10 years. I hope in 5-10 years we can see these therapies incorporated into mainstream medicine, but that's just a hope. Playa del Carmen is a great city. It has everything to offer. People that come here won't have a bad time at all. You can have all kinds of sports, all kinds of activity. If people that like nice restaurants and dinner in those places, you can find a wide array of that. So Playa del Carmen is a very cosmopolite. It's a young city. It's growing, and it has a lot of offer to the visitor. And for us that live here, we just love the beach. We just love to go to the cenotes and the jungle. And it's great to leave out your office and then can go to the beach or hang out in the jungle. I think that's a great plus.